Right, it's 1:30 then, so I'm going to make a start. So first of all, good afternoon, everyone. Hope you are all doing well, and thank you for attending today's Ardens webinar, in which we're going to look at delivering the obesity QOF domain, so the new indicators for this financial year. For those of you that I've not met yet, my name is Charmaine Jackson, and I head up the training team for Ardens. I'm also joined by my colleague Mariette Hadfield, who you can see on screen. Mariette is one of our training specialist leads. We've also got our development team on a call today. So we've got James, who is head of development, and we've also got Alex, who's one of our senior developers, and they're going to be around to help us with any questions that you may have throughout this webinar. Now, we decided to put this webinar together today as we've noticed that there is quite a lot of uncertainty, quite a lot of questions that have been raised through our support team, our training sessions, also on our Facebook group, of just uncertainty around the expectations of what you need to achieve for QOF this financial year. So we're hoping that out of today's webinar, and we've already done the one for EMIS just about half an hour ago, we finished that, and that went really well and people felt more confident. We're hoping for you that you feel a little bit more confident walking out of this webinar today, knowing exactly what you need to do, but more importantly, knowing how we can help you. We want to make sure you know the resources that are available for you. Like I mentioned, this is for SystmOne practices only. If you're on EMIS practice, it's already happened, but we will make sure that we share the recording. This is going to be recorded today as well, so you can refer back to this recording. If you're someone who likes to take loads of notes and you're trying to struggle to keep up with us, know that it'll be recorded and you can refer back to it as much as possible. Normal standard housekeeping information, so you're not connected to a camera or a microphone. If you have any questions that you would like to answer us, please use the Q&A section. Have a look, see where it is in case you're new. Make sure you're comfortable with using it. James and Alex is there ready to answer your questions that you have or any feedback that you want to provide for us today. 30 minutes. We want to make it short and snappy today. So this is a 30-minute session. We're going to try and keep to that as much as possible. We appreciate it also depends on the questions that may come through. We will try and answer as many questions as possible, but note that if we can't, we will follow it up with an FAQ that we will send across to you with the recording after this webinar today. So in terms of what we're going to be covering and doing it in this order as well, I'm going to start with a very quick summary of what the obesity requirements are for this financial year. We're then going to move on to a demonstration. So Mariette will show you the reports that we have available, templates we have available to help you record data, and then to finish off with Ardens Manager. We're then going to look at next steps on what you can take after you leave this webinar today, and we're then going to look at ongoing training and support. Now, before we do all of that, it'd be really good if we can just fire off a quick poll question even, just to check to see how confident you actually feel in this area right now. So I'm just going to fire this question here. How confident do you feel about the QOF obesity domain? Number one, you're totally confused. If you're totally confused, that's absolutely fine because you're in the right place today. Perhaps you're somewhere in the middle, or perhaps you're at a number 5 where you're completely confident in how to deliver the obesity domain for this year. So if you can just pop your questions in, that would be good. And we can have a look at what that is. Has that poll question come up, Mariette, on your side?
It hasn't on mine.
Let's try again. Joys of technology. We might just have to go to the next slide. Well, oh, here we go. Let's try that now.
Yep, some responses have come in.
Cool. So if you just pop in your answer, totally confused by this at the moment, or perhaps you're quite confident, or perhaps you're somewhere in the middle, let us know. You can also use our Q&A. Results look the same really as what we had in our previous session, where people were kind of at the number 1, number 2. We've got a few of you who are at number 4, which is really good. So yeah, hopefully that will change by the end of this session. We'll keep that going, and let's move to the next slide then, Mariette. Okay, so for this webinar today, as mentioned, we're going to be focusing purely on obesity today, mainly the QOF requirements. So it might be worth checking locally if you're doing anything for obesity. It might be worth checking in with your ICB to make sure that you have everything covered. We're telling you what you need to be doing nationally. You may also want to look to see if you're doing anything locally as well. So check that out with your ICB. Now, what's expected for QOF, and what you'll find is a lot of what you've been working towards in the previous year for obesity is still the same. So you were referring patients for digital weight management program. You are identifying in some areas patients who are eligible for an obesity medication pathway. So a lot of that's the same, but you've now got an incentive to be able to work towards that. And that's now all part of QOF. Like I mentioned, just check to see whether or not there's anything locally that you're doing as well. So starting with the registers then, previously there was a register that you had to maintain and you were incentivized, you had money towards that, achievement towards that. This time round, it's very much the obesity registers are linked to the obesity indicators, which we're going to talk about in a minute. So there are two obesity registers that you need to be aware of. You've got OBES-Reg, which is mainly linked towards OB004 indicator. And this is looking at patients who are aged 18 years and over with a recorded BMI in the last 12 months, but that recorded BMI needs to be 30, or if they're a BAME patient, it's 27.5 or above. So that's the requirements you need to meet in order to be on the OBES-Reg register. You then got OBES-Reg 2 and this, or OBES-2 Reg, and this is mainly linked to OB005, and we're going to talk about the indicators in a minute. But this is looking at, again, patients who are over 18 with a recorded BMI in the last 12 months, but the BMI range is slightly different. 35, or if they're a BAME patient, is 32.5. So they have to be in that category, but also they must have at least 4 weight-related conditions, and we've listed out what those are. So you've got ASCVD, you've got unresolved hypertension, etc., etc. So all of those, but they must have at least 4 of those in order to be on that particular obesity register. Now, in terms of your indicators, there are 2 indicators. You've got OB004 and you've got OB005. Now, OB004 is based on that first register that I mentioned, so OBES-Reg. And what that's looking for is a referral being done. So it's a weight management referral within 90 days of a qualifying high BMI. It has to be recorded correctly in your clinical system. And it's important to note that the actual activity needs to be for this financial year. So anything from the 1st of April 2026. There are some exceptions for OB004. So where the service is not available, you can record the fact that it's not available in your area, and that's an exception. Patient may be unsuitable. Patient may have declined as well. And then you've got your normal responder to invites, which is also an exception too. So there are some exceptions there. OB004 is quite an interesting one. Although most of the activity is looking for this financial year, there is a bit of overlap between the BMI happening and a referral happening. So if you've got a bit of a crossover where a high BMI was done in the last 3 months of the previous financial year, but the referral was done at the very beginning of this financial year, you can still count that towards your QOF achievement. So what I mean by that, let's say, for instance, you've got a patient who had a high BMI in February time. If the referral was done correctly within 90 days and that goes over to this financial year, that will still count towards achievement as well. So it's just a little bit different there for OB004. OB005 is all about the weight management injections. So patients have to be on the OBES-2 register in order to even get to that point. And what we're looking for here is we're looking to make sure that in the last 12 months, they've had this following information recorded. So all 3 codes have to be present in the patient record. And that's a shared decision-making discussion about the management of obesity. It's an offer of the approved medicines management, and it's a referral to the suitable behavioural support program as well. So you have to have those 3 in, as well as the requirements to get to that point on the register in order to meet achievement. If you look at the points and the thresholds there, they're not massive. So for OB004, it's only about 5 points. The threshold is quite low as well, so it's quite an easy one to get. So you've got 10% in order to at least get some points and some payment for that indicator. For your OB005, slightly higher, it's 13 points, a slightly higher threshold you need to meet is 50%. So really think about that for your planning, when you're doing your QOF planning in general, how are you going to fit obesity in, remembering those thresholds and points as well. And hopefully that makes sense. We do have a support article which explains it too. Give us the thumbs up if you're okay. If you have any questions, then please use the Q&A option. But thank you for the reactions. Brilliant. But what I'm going to do now is I'm going to pass you over to Mariette now, and she's actually going to show you how you do it in Ardens to really fully support you in this area. So over to you, Mariette.
Lovely. Thank you, Charmaine, and good afternoon, everyone. So first of all, going to jump into SystmOne. This is not a live SystmOne site here, so this is just a reporting unit, so there's no patient data available in this one. The first thing we're going to take a look at is the template. So I'm going to open up my QOF obesity template. So this one is specifically just for your obesity indicators, and on here you've got the ability to see those two register categories that Charmaine mentioned on there. So you've got your obes reg and obes 2 reg, and it just confirms that criteria for you there if you ever get stuck. This template also gives you the ability to update your height, weight, and BMI score here. And just to say that once you click into those boxes, any previous recordings you've made will be visible on the right-hand side here. As we get to the indicators themselves here, so for your OB004, for your weight management referral, you've just got one code available for this one, and you can use the drop down to pick whether you have referred the patient to the weight management service of your choice or that the patient has declined. You do also have the option to access the obesity and weight management template here for any further consultation follow-ups that you want to do, and we will look at that one very briefly after this template. On to OB005. So this one is where your medication pathway comes in. So you need shared care discussion, offered of pharmacotherapy, and behavioural support referral in the last 12 months. So using these drop downs, you can see which codes are included for this one. So you've got your referral to the NHS obesity medication wraparound support pathway, pharmacotherapy, meaning that you've started that pathway, and you've also got your decision-making conversations that you can code in here. And all of these codes are also available on the obesity and weight management template for any of your clinicians using that one. Finally, in terms of the personalised care adjustments, you've got a whole list of these ones here. So whether it is invitation codes you've added, the patient is unsuitable for that programme, or perhaps the service isn't available in your area, anything that you want to record here to exclude the patient from this indicator, you can do that via this personalised care adjustment section. So looking at the obesity and weight management template, you can access it through this quick link on the template here, or you can just start off using that one. And this is where you can capture all of those detailed clinical best practice discussions to help you support patients through that process. So in terms of the referral, you'll see there's a referral tab here that guides you through all the different types of referrals that are available. But as Charmaine stressed, that you must see what is available within your area and if there are any particular restrictions. But on here, you've got all of those different codes available and things that you want to refer to. Your injectable formulary tab will also give you the link to the obesity medication pathway template, so that will have further support available to help you guide your consultations with patients. So that's your templates. The next part to have a look at is reporting, and for that one we're just going to go into our clinical reporting unit here, and we're coming down to our contracts QOF folder. Now there's a few folders just to point out here. First of all, you've got your time-sensitive searches. So those first three at the top there will help you to identify for those patients who are eligible, how much time is left for you to do that referral. So you've got 0 to 1 month left, 1 to 3 months, and you've also got a category for time expired. Although the time has expired there, it's always worth just reviewing those patients just to see if perhaps a referral was made, but some coding was just missed off, and that way you can retrospectively add on the coding to make sure that you still achieve the indicator for those patients. In terms of your outstanding patients, on these ones you can see how many patients you still have outstanding. Now, usually you would use your QOF indicators screen for this one, but for the time being, while TPP are updating all of their QOF reports, the obesity domain won't be available in your QOF indicators just yet. So for the time being, this does give you some patients to start working on. And finally, in terms of achievement, there are no reports available for achievement in the reporting unit because you would use your QOF indicators screen for this one. So just remember to access that one, you would go to reporting at the top there and pick the option that says QOF indicators, and that will then give you that screen to see how many patients you've achieved and who are still remaining. Now, just before we jump into Ardens Manager, just want to quickly talk about patient alerts. So with your QOF alerts on your patient home screen, you are going to have to set up the alerts so that they link to the Ardens templates. Now, if you're not sure how to do that, if you go to Setup along the top here, go to Data Output, and then from there you've got QOF Alerts Actions. So if you click on that one, and you're going to want to create a new QOF alert. Click on that new local alert and then pick the indicator from here. So we're going to scroll all the way down until we get to obesity. We're going to start with OB004. And then for the template, we're just going to click that button and you're going to search for QOF and pick the Ardens template. You'll know it's an Ardens template because it has the red star links to them. So we're going to pick the obesity QOF template there and just click OK. And then you can click OK and you've created yourself a new alert there. So repeat that process for both of those indicators, and that way when your alerts are on the home page and you click that action button, it will take you directly into that QOF template for there. So that's your SystmOne side covered. So hopefully now you know how to record the data, how you can use the obesity and weight management template to support your consultations and supplement any of that additional information, and you know where to find all of your reports. So just going to swap my screen into Ardens Manager. Bear with me while I log back into this one. So we're going to briefly take a look at the QOF dashboard on here and how this one can support you for those of you that use Ardens Manager. So we're going to come onto our QOF dashboard. And I'm just going to use the lifestyle tab at the top there, just so I can separate the indicators out. So clicking on lifestyle there, I'm going to come down to my obesity domain on here. So this is quite useful. You can see both of those indicators down here. You've got these nice performance bars so you can track how well you're doing with the indicator. So as you're planning things and you're working your way through this indicator throughout the year, you can see how close you are to each of those thresholds. So with your OB04, we know that it's 10 to 30% achievement threshold here, and you can see the dotted lines on here indicating where that is, and the dark grey bar will track towards those, so it's nice and easy to see. And then for your obesity number 5, you can see that the thresholds there are a bit larger. In terms of your achievement, you've got the traffic light system. So at quick glance, you'll know whether you're red, meaning below the minimum threshold, amber will be between the two, and green will be achieved on those ones. Importantly, though, you've got your remaining to achieve patients here. So this section will show you how many points remain, but crucially, how many patients do you still need to see to meet that maximum threshold on there. So do make use of this number here to help you plan how many patients you need throughout the QOF year to be able to achieve as much as you can on that indicator. You can view the list of patients from here. So click that view button and that will open up your report breakdown. Once this loads up, you've got a patient tab available. So within this patient tab, you've got access to your patient list. Just remember that by default, it will show you the full cohort. So do make sure that you are using the show remaining only option on here, just to make sure you're dealing with the correct patients. From here, you may want to have a look at their single patient view. So click that view button on there. This will show you what else is outstanding for this patient. Now, granted, there's a lot outstanding for my test patient here, but in this case, we're going to bring this patient in to get a new BMI. We're going to raise a referral. We might be starting them on that obesity medication pathway. So while we're bringing them in to have an interaction, we may want to just see what else is outstanding. What else can we use to maximize that patient contact with? So in terms of QOF, my patient still needs diabetic indicators. They need respiratory, and they also have a hypertension indicator outstanding. So do take a look at that one. Now, following on from here, you can use this button in the top right-hand corner to open the record in SystmOne. I know mine says EMIS, but yours would say SystmOne. And if you click that one, it launches the patient record. So you can take a look at the record there, invite the patient in, book an appointment, and do what you need to do from that aspect. Just coming back to the main dashboard here, just to point out that we obviously talked about those PCAs, your personalized care adjustments. So Ardens Manager also helps you to track those ones. So if you do want to keep an eye on the number of patients that you have got excluded from your indicator, you've got one for both of those on there. So I'm going to pause there and hand you back to Charmaine and just check if there's any questions that we need to raise for this one.
I think probably the question that we had in the previous session around what happens if they've missed. So we're looking at OB004. Patients had a high BMI, but they've missed the time frame for the referral. So it's now more than 90 days. So someone said that apparently if you miss one, you can re-add a new BMI and it resets the indicator. Is that correct? And I know Alex has responded to that and say yes, as long as there's a high BMI in that QOF year, it's always looking for that high BMI in order to do the referral. So you should be fine to do that. Yep. And I don't think there's anything else. If we send out 2 invites 7 days apart, if no response for the patient, can we then accept them? No mention made so far of automatic accepting example after 2 invites. Now, I'm not sure. Do you want to answer that? Because I know in EMIS how you do that.
So yes, this does have a personalised care adjustment for 2 invitations. The Ardens way of approaching personalised care adjustments is to not add them at point of initial invitation, but rather focusing on the patient care. Then our LTC suite will have reports that will pick up patients who have been invited in for elements of care and the care has not been accomplished. So at that point, you can add both the invitation exclusion codes, and thus you're only adding the personalised care adjustments for a small number of patients, and you're not running the risk of artificially inflating your PCA numbers and getting CQC's attention.
Thanks, James. And we just had a question coming in. You may want to stay on and answer this one. So if they have a BMI done again after we have referred, will it highlight they need referring again? So I think that's another.
Nope. So the indicator looks for a referral occurring after any eligible BMI. So if you've had a high BMI, you refer them. If you do the BMI again, it won't reset the referral. You will still get the credit for it. There's also another comment on here around having a high number of patients in the time-sensitive search. Unless you generally have absolutely 0 weight management options in your area, bear in mind that digital weight management, diabetes, and the National Diabetes Primary Prevention Programme, Weight Watchers, referrals to gym, all of those count, then don't add the no local weight management service available. Our advice would be for those patients is get them in a filtered manner through the year to get the BMIs redone and refer them at point of redoing the BMI. That way you can have a constructive discussion with the patient that you're going to refer them, rather than just sending them a message saying, oh, we've referred you. It just improves patient care.
Someone has said though, but what if the BMI drops below the threshold? They've repeated it and it's now dropped.
So in that case, unfortunately, it is a missed patient, but this is why you've only got a 30% pay threshold to hit. So the contractors, when they were taking this into account, kept the thresholds low on the grounds that there is the situation where you BMI someone, they go and action it, and they're only borderline, they then drop below, so you miss the ability to refer. So it's why there's a 30% ticket to hit.
Thanks, James. Okay, shall we look at next steps? Anything more we want to cover on Ardens Manager, Mariette, or we're happy to move on to next steps?
No, happy to move on to next steps.
Okay, so hopefully that's been helpful. We're going to still keep, we can see the questions coming through, so we're going to still keep answering the questions, so please do send them through. In terms of where we go from here, so what we're suggesting is share the support article that we have linked you to, and also share this recording once it becomes available to all of the staff you feel it's going to be useful for them to know about it. Going to stress again, just make sure you check to see whether there is any local pathways you need to be following. This is just national we're talking about today, but is there anything locally you need to be doing? Is there any restrictions there? Maybe you can't refer to certain services, for instance. Maybe you haven't got the service available in your area. So it's really important that you are checking locally what you need to be doing. Once you understand all of that, now identify your eligible cohort so you can plan ahead. So Mariette has now shown you how you can find your outstanding patients, both within the clinical system and Ardens Manager. Let's put a good plan together now on exactly how we're going to deliver it for the rest of the financial year, because we know, particularly for OB004, we have a tight time frame that we need to be working towards. Also review your clinical coding. Make sure that your clinicians are aware of exactly what Ardens templates they should be using to support them in this area. And next slide. So really, it's just to say, if you feel that you need some further support in this area or for Ardens in general, then please do reach out to us. You can contact training@ardens.org.uk. All of our training is free and we're more than happy to support you if you need further training sessions. Also to let you know that you can contact our support team at any point, support@ardens.org.uk. You can come with your questions. We've got a whole support team ready to answer your questions, and we've also shared the support article with you as well. Next slide. We have just launched a QOF training program. So this is quite new for this year that we're doing for you, because we want to support you with QOF all throughout the year, not just at the beginning and at the end. We want to be with you every step of the way. So therefore, we have put a training program together for you, which will start from next week. So if you have anyone in your practice who's completely new to QOF and can do with understanding the principles, then send them along to our session on the 8th of July. It's all on our website, our new website, ready for you to be able to book anyone on. So please refer them. Remember, this is all free. We're also going to be doing on the 14th of July, if you're an Ardens Manager customer, we're going to show you how you can use Ardens Manager to build a really effective QOF delivery plan so that you're working on QOF throughout the year. We're going to do a session for your clinicians as well. Are they using the right templates? Do they know what QOF resources are available? So all on our website. Please do book on if you feel it will be useful. Now, what I'm going to do, while I've got the feedback up there, I'm just going to launch the poll question again, and hopefully this one is going to work properly, because it'd be really good to see, now that you've had all of this information now, how confident do you feel now? Do you feel that you are ready to deliver this confidently? Maybe you're still a little bit confused. It's absolutely fine. It'll just be good to see how you've retained that information and how we can support you going further. We've purposely done a really short and snappy session today because we want to make sure that we're keeping it focused. If you feel it'd be really useful to do more of these snappy webinars, then let us know in a Q&A. Perhaps there's other areas of QOF that you want a little bit more in support in. For our EMIS one, they answer for heart failure, they answer for mental health. If there's anything else that you need support in, then let us know. We're here to help you. Let's have a look at these results. What have we got, Mariette? Oh, you're on mute.
Oh, I'm on mute. I'll say that again. Lots of responses. We've gone from 1s and 2s all the way to 3s, 4s and 5s now. So
amazing. Perfect. It's really good to see. Thank you so much, everyone, and for your time as well. We'll leave the feedback form. Couple of seconds just to provide your feedback on where we can improve on our training and also where we can improve on our products. So if you've got any questions further questions for our development team, let us know. I think we have answered all the Q&As in this one, so I think we're all right, but we will hang around if not. But other than that, thank you so much for your time. Hopefully we'll see you on the next QOF webinars happening over the next couple of weeks. Let us know if there's anything more you need, and we hope you enjoy the rest of your day. So thank you very much, and we will see you all again. We'll hang around just to answer the last few more questions. If you've got one, it's your last minute to get one in. So thanks, everyone. Just to come out of the meeting, it's just the red leave button.